Sorry. Oh, good grief. Hi. Hello, everyone. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Here on this fabulous Friday, the last weekday in July, can you believe it? To give you some updates on COVID-19. Probably have a pretty brief update today. It's been busy, and Mark and I are tired and ready to get home. All right, there was a bit of a problem with the overnight processing of all of the millions of records by the statewide surveillance system. So the state health department, the Alabama Department of Public Health, issued a notice saying there was an issue with the reporting database server last night, which prevented the overnight processes from completing successfully. Because of that, reports that feed the dashboard, the state dashboard, and the data that feeds to us that we build our reports with will not be available today. Please check back tomorrow for the next update. For us, of course, that will be Monday. Thank you for your continued support and patience. So because of that, we do not have a report on the number of COVID cases added yesterday. So we still stand at 47,680 cases. And we'll have to update you on Monday about what happened yesterday through Sunday. So the number of died has not changed. The number of hospitalized, it's at 864. The hospital data comes from the Alabama Incident Management System. That system was not affected with the woes of the reporting database server. So we have a total number of hospitalized with COVID, 6,355, with 30 additional admissions. And yesterday in the hospital, there were 228 people hospitalized with COVID. Today, sort of the unofficial number is, I think it is 253. So by the time I report to you on Monday or Tuesday, we likely will see the highest number of hospitalizations for COVID-19 since we began reporting, or since we began seeing COVID in the community last March, or 2 Marches ago, March of 2020. I just want to remind you, I've gotten lots of questions. One came in today that says, are the numbers in the are the COVID numbers in the infant and daycare age group going up compared to what we were seeing earlier? Yes, I reported earlier this month that when you look at just the 2 weeks after 4th of July and compare it to the 2 weeks prior, that the number of cases in 0 to 4-year-olds increased 5-fold. So we saw 5 times the number of cases of children aged 0 to 4 just in a 14-day period. And if you take a look at our report from yesterday, we're reporting that 4% of the cases were in the 0 to 4 age category, so 165 cases in those infant and daycare age children. We're hearing lots of outbreaks happening in daycares. And it's not just COVID, people. I mean, yes, COVID is more highly transmissible. We know that. But it's unvaccinated, our community that is largely unvaccinated, that is allowing this Delta variant, this more infectious, get out there. And again, we're not distancing like we were. We're not wearing masks like we were. So it's not just the fact of it being a COVID variant that is more highly infectious. It's the fact that we have low vaccination rates. We are not using consistent mask wearing for people who are unvaccinated, and we're not social distancing. So, and the other thing that we hear not doing is people just seem to not want to stay at home if they have COVID. And so if you have COVID and you go, on about your business, then you are infecting people around you. So if you are sick or diagnosed with COVID, stay home, please. Let's see. Someone else, I think we had been talking about the fact that the data are still being compiled and still being looked at and still being analyzed as to whether or not some people may need a booster dose of vaccine sometime in the future. The current 2-dose schedule has proven to be protective against severe disease and death caused by COVID-19, including the Alpha and Delta variants. There may be in the future some change in that posture, but for now, there is not. Pfizer came out earlier this week and said that data show that a third shot or a booster dose could help with people who are immunocompromised, and some kind person volunteered to join that study. So those clinical trials have been going on now for probably a good year and a half with the cohort. So I don't know of any clinical trials that are currently recruiting for volunteers, but thank you for your willingness to partake in that endeavor. All right, a couple of other questions. I'm still getting a lot of questions about, the characteristics and the frequency of COVID infection in people who are vaccinated. And let me just remind you that the overwhelming majority of cases that we see of hospitalizations and deaths are in unvaccinated people. 80 to 90 or more percent of deaths occur in unvaccinated people. Around 90% or more of hospitalizations in unvaccinated people. The overwhelming majority of cases, new COVID cases, are in unvaccinated people. So I want to emphasize that and de-emphasize that some people, yes, that get fully vaccinated may still get COVID. And that is unfortunate, but we expect that to happen. It is not a failure of the vaccine. It's not simply because of the COVID variant. It's because we have high levels of transmission. We don't have the firewalls in place needed to stop transmission. So focus on the need to get vaccinated to protect our community against COVID. We also have plenty of people who are getting reinfected. Lots of folks think that if they had COVID before, they won't get it again. That is not true. That's false news. It is not true. We are seeing it, many more times I see a reinfection than I see a fully vaccinated person who gets COVID. So it can happen. You can get COVID a second, third, or fourth time. And we will not be able to reach herd immunity without vaccination. I'm hearing people out there saying, well, if we all get it, this wave, then we'll be protected. We'll have herd immunity. It may be that you'll have some measure of natural immunity against the Delta variant, but as soon as we have a different variant, we'll be starting from zero all over again. And I don't think anybody wants that cycle to continue. So let's focus on the importance of getting vaccinated. Let's see, someone asking, have recommendations for quarantine changed for vaccinated individuals who test positive? This sentence gives me so much concern because there are so many different messages in there. If you are vaccinated and you test positive, you must isolate. You must go home for 10 days. Anyone who tests positive for COVID, regardless of vaccination, must go home for at least 10 days, and you can discontinue isolation on the 10th day as long as you have been asymptomatic for at least 24 hours. Fully vaccinated people who are exposed to COVID are exempt from quarantine. So if you are fully vaccinated and you are exposed to COVID, you don't have to go home for 14 days for quarantine. You can still go to work, go to school, go to church. So a couple of different things going on in that sentence. Anybody who has COVID, tests positive, regardless of vaccination status, goes home for 10 days. All right, a question here, do you need to get tested before you get vaccination? No, absolutely not. If you get tested for COVID, if you're asymptomatic, if you go in for testing, particularly at one of our clinics, please get vaccinated at the same time. Sort of the only two reasons we might defer vaccination is if you are sick, right? Because in general, we don't vaccinate people when they're sick. Or if you are allergic to any of the components of the vaccine or have had, a severe adverse event following a vaccine. If you go to test and you test negative, get vaccinated while you're there. Just go ahead and knock it out. I'm often surprised at people when they come to test. They're like, "Oh, thank goodness I'm negative." You can remain negative if you take a perfectly free vaccine. So they'll be like, "I'm not sure." Well, people tend to sort of, not maybe take it seriously until it happens to them. So if you are worried enough to go and get tested, then please get a vaccine to protect yourself. Don't just remove that worry from your table. All right. So, is it true that your body takes 2 weeks after vaccination to build immunity? It is true that it takes about 2 weeks after your last shot to get the full measure of immunity. That's when you're 94 or 95% protected. You will have some immunity a couple of weeks after your first shot, a couple days after your second shot, it'll get much higher, but your full measure will be 2 weeks after your last shot or 2 weeks after your first shot of J&J, since that's a single dose vaccine. Let's see. So there are some questions here about the recent, sort of point back to the recent guidance from the National Public Health Agency, the CDC, Centers for Disease Control, that in a place like Mobile where there is really high transmission, that vaccinated and unvaccinated people should still wear masks indoors. So, when we get back to, right now we're above 20% of tests are positive. When we get back to less than 5%, like we were in June, then maybe we can relax the recommendations and say, okay, community transmission is really low again. So vaccinated people maybe don't, can go back to normal. That was the message in June, but we're not normal right now. We're in over 20% test positive. So community transmission is so high that both vaccinated and unvaccinated people should wear their mask. And I think that's it, unless there are some questions that came in, Mark.
There's some what we can do. Did you get the KRG?
Let's see. Yeah.
Okay.
Yeah, about daycares in the county closing because of COVID. We are hearing that happening. The health department does not close daycares or schools or businesses. It really comes down to the business owner having enough students or having enough teachers or caregivers to run that clinic. But yes, there has been a 5-fold increase in COVID cases in children of daycare age 0 to 4 years old. We are seeing that all over the county. So it is a true phenomenon. All right, that's it for today. We will talk to you again on Monday. Be safe, get a vaccine, enjoy your weekend.